So we're going to do thiamine, which we'll discuss what that is here in a second for those of you who are not know. We're going to do thiamine and peripheral neuropathy. Dr. Gates, board certified chiropractic neurologist who practices functional neurology, and myself, Dr. Rutherford, certified functional medicine practitioner. We work together with a lot of chronic pain patients. Peripheral neuropathy is one of our largest patient populations, and we're pretty much doing little snippets on about every aspect of peripheral neuropathy that Dr. Gates can think of. There is a commonality out there among the medical model that indicates that half of peripheral neuropathy is diabetes, the other half we don't know what it is. If you fix your diabetes and it stays, then you have to live with it. There is some further data out there understanding that a low back problem, a neck problem, a ankle problem can cause it. There's a little bit more awareness online of alpha lipoic acid possibly being able to help it, B12 deficiencies being able to help. And that seems to be the extent of the understanding of peripheral neuropathy as people of the patient population that comes into our office to be evaluated for our programs. The contemporary neurology series put out by the
American
Academy of Neurologists, which comes out every year. It's more or less considered the Bible of the neurology field. It's a book that is supposed to be the standard for neurologists, neurosurgeons, and so on and so forth. Put out over in that book, and in their peripheral neuropathy series indicate that there is at least 80 different causes of various types of peripheral neuropathy. And our understanding of it from our experience is that we're more in line with that. So we're going to be continuing to do different aspects of peripheral neuropathy. And today, Dr. Gates would like to maybe educate you a little bit on thiamine peripheral neuropathy and its uniquenesses, and that it even exists and what the symptoms are, and maybe how you could be fortunate enough to get some help with it.
So thiamine, or vitamin B1, is a vitamin that's necessary for processing carbohydrates. Namely, there are other biochemical functions that's involved in, but simplistically that's what it's needed for. And thiamine is not something that our body produces, so we have to consume it. And vitamin B1 is consumed from things like beef, nuts, cereal grains, amongst many things. And usually deficiency in thiamine comes from when we're not absorbing vitamins that well. Things like gastric bypass surgery, celiac sprue, which is celiac disease, is where you have an autoimmune problem to gluten.
Or not getting it if you're a vegetarian.
Or let's say you're not consuming foods rich in thiamine, maybe you're malnourished, things of that nature. And then also irritable bowel disease, pernicious anemia, which is where the immune system attacks B12, has also been correlated with thiamine deficiency. People who vomit frequently, bulimics, very, very common cases of thiamine deficiency. Also alcoholics. Alcoholics, when they drink alcohol, the alcohol itself prevents the absorption of vitamin B1, as well as decreasing the amount of B1 in your liver. Now, with all that out of the way...
So if you're an alcoholic vegetarian, you're in trouble. Decide to make them laugh.
Yeah, exactly. So if you're deficient in thiamine, it can result in peripheral neuropathy. The peripheral neuropathy that develops is largely a large fiber peripheral neuropathy. Now, in talking about peripheral neuropathy, think of your sciatic nerve, and think of that sciatic nerve as it courses down into your foot. There are many different types of nerves in the sciatic nerve. Some are big in diameter, some are small in diameter. And the small diameter nerves sense things like pain, temperature, they control blood flow, things of that nature. The bigger nerves, the larger nerves, sense things like vibration on your toe. They sense where your toes and your joints are at in your feet so that your balance can be good. And with thiamine deficient neuropathy, most commonly it can go a few different ways, but most commonly it involves more of a large fiber neuropathy presentation, as opposed to the purely alcoholic neuropathy, which we have a video out there on as well. And so with thiamine deficient neuropathy, and this is becoming an increasingly more common problem because of gastric bypass and things of that nature, and there seems to be a rise of the incidence of celiac disease and things of that nature.
I think just in general, bad
nutrition,
bad GI problems that we see almost
all the time
globally with our chronic pain patients.
Yeah, and that can result in B1 being deficient and peripheral neuropathy. Basically, B1 deficiency is best diagnosed not by a vitamin B1 test in your bloodstream, but by something called an erythrocyte transketolase. So if you want to talk to your doctor about that, if you think this may be a possibility, mention the erythrocyte transketolase test to them. And in essence, in rehabbing a thiamine deficient neuropathy patients are given, they're given a certain amount of thiamine a day IV. I think it's about 100 milligrams 3 times a day IV, and then 50 to 100 milligrams orally for every day for a period of months afterwards. I'm not telling you to do that. You're not my patient. But just know that is the standard treatment protocol. What we do that's unique to peripheral neuropathy, and the reason why we're putting out all these videos on peripheral neuropathy.
The functional world.
Exactly.
What the functional world does in this.
Exactly. Is that most commonly, if you have peripheral neuropathy and you go to your doctor, you're going to be told there's nothing that can be done for peripheral neuropathy. Or maybe take these vitamins, see if it gets better. If it doesn't, then there's nothing that can be done. We try to meld the approaches of addressing the metabolic problem, in this case, you lack vitamin B1, with trying to stimulate the nerves back into life. Now, there have been studies done where, let's say, the metabolic cause is not addressed, but they just stimulate the nerves. People will oftentimes feel better for a couple days, but the results are short-lived, and that's why doctors tell you there's nothing that can be done. What we're doing is something unique and novel, such that we're addressing metabolic causes with stimulating the nerves, shocking them back into life, for lack of a better word, and seeing what happens with the patient, seeing if they get better. We properly select our patients to where we only take patients who we think are going to improve with our treatment program. This is not a cure for everything, but what we're seeing are also very exciting results where these neuropathy patients, if we address things like a vitamin deficiency, coupling that with stimulating the nerves back into life, people oftentimes feel better, they get more sensation in their feet, things of that nature.
You might want to be a little bit more specific on stimulating nerves and shocking them back to life. And people are very interested in that before they sometimes they've heard that or something and say, well, does it hurt? And is it,
it's not painful. If it's painful, there's a problem, and whoever's doing it is not doing their job correctly. So it should not be painful.
Shocking you hard enough.
It's basically putting some electricity into the nerves down there, causing those nerves to fire better.
It's a gentle process.
So those nerves increasing their metabolism. We use the example of stimulating a weak muscle. If you haven't used your muscle and it's dying, then you can go and you can exercise it appropriately. That's what we're trying to do with the nerves. And the interesting thing with the nerves is that many times in peripheral neuropathy, you can easily overstimulate them.
Right.
Just as much as maybe not stimulate them enough.
And different stimulations are better for different types of nerve fibers. Yeah. Like we've done a number of presentations now on small fiber peripheral neuropathy, and we utilize that in addition, or use instead of that different types,
different modalities and different locations of stimulation.
So you need to understand which electrical stimulations are better for large fiber peripheral neuropathy than for the small fiber peripheral neuropathy. We're talking about large fiber peripheral neuropathy right now.
Exactly.
And it doesn't hurt. It doesn't hurt. We don't have anybody complaining that it hurts.
So that's what we have to say about thiamine deficient neuropathy. I think that's pretty conclusive.
Yeah, if you have it, there's very possibly a solution for you, would be, I think, the takeaway that is out there, and with a proper evaluation, it can be determined whether you are a candidate for that in a functional environment.
Exactly. And I would say if they have any other questions, they can go to powerhealthtalk.com. We have many videos up there. You can also search for other forms of neuropathy on YouTube. We have many videos up there, B12, statins, diabetes, peripheral neuropathy, pre-diabetic, all those things.
You can spend your entire vacation watching our videos, watching our presentations.
And you can also go to our Power Health Facebook page and like our Facebook page. So thank you for watching, and have a good day.